Today we can discuss disorders of perception. Some words which are used in psychiatry, that is disorders of perception. One is illusion, another is delusion, third is hallucination. So we can see what are the differences between these words. These words are used in psychiatry. So what is illusion? Illusion means misinterpretation of something. Misinterpretation of something. So the brain is misinterpreting. That is, it is interpreting something as false. That is illusion. So you can see the examples of illusion. A common example is that when a person sees a rope, he tells that it is a snake. Actually, it is a rope, but he tells that it is a snake because his brain misinterprets the rope as snake. This is a common example of illusion. So it is misinterpretation of an external stimuli which is present and the brain is perceiving falsely. The second word which is commonly used in psychiatry is delusion. So what is delusion? Delusion means false, unshakable belief which is persistent. False, it is not true. The belief is not true. Unshakable, it is not shakable. That means it cannot be changed. And false, unshakable beliefs, that is, it is something related to the beliefs or thoughts which is very persistent. That means continuous. It is continuous. It is not temporary. It is a permanent belief. This permanent belief. So delusion is a false, unshakable belief which is persistent and permanent. So we can see what are the common types of delusions present in the people. One is delusion of persecution. Another thing is these types of delusion, illusion, hallucination are seen in mental patients. That is, those patients with psychiatric illnesses. These are all abnormal, not at all normal. So delusion of persecution. Persecution means someone following and doing some violence. That is persecution. So delusions of persecution. So the patient thinks that someone is following him, someone is following behind and doing some violence. Something that is sometimes the patient says that someone is putting some poison in the food in order to kill him. He thinks so. That is unshakable false belief. The belief is not true, is not unshakable, it is not changeable. That means he thinks that he cannot eat food because he thinks that someone has poisoned his food or someone has poisoned his drink. That is the delusion of persecution, or somebody is going to kill him, or somebody is going to do violence over him. That is the delusion of persecution. Another common type of delusion is grandiose delusion. Grandiose delusions or delusions of grandeur. That means the patient thinks that he is a superhuman being. Somebody who is very poor believes that he is very rich, he is immensely rich. He is the CEO or director of some big companies. He thinks so, but he is an ordinary employer there. So, the delusion of grandiose delusions. That means he thinks that he is big, he is larger, he is superhuman being. That is grandiose delusions. Another type of delusion you can see in the mental patients is delusion of infidelity. Fidelity means faithfulness. So infidelity means unfaithful to somebody. That is usually seen in alcoholics. That means people who abuse alcohol. So they develop a disorder, that is alcoholism or alcohol dependence, which is a substance abuse. So alcohol is abused and they develop the disorder, that is alcohol dependence. These people can develop delusion of infidelity. That means they believe that their wife is unfaithful to them. That means their wife is unfaithful, their wife has some extramarital relationships. That is a delusion. That is a false belief. That is an unshakable belief which is not true and that cannot be changed also. This comes due to the alcohol dependence. So this is a delusion of infidelity. So these are some types of delusions. That is false unshakable beliefs. So this delusion of persecution and grandiose delusion usually you can see in schizophrenia, one type of psychiatric disorder which is very serious. Another word that is a disorder of perception include another word that is the hallucination. What is hallucination? Hallucination means the person will see or the person will hear something which is not at all present. There is no external stimulus, but they see or hear which is not at all present. Example is visual hallucinations, that means seeing. Using the eyes, the patient says that there are ghosts inside the house. Actually, there are nothing. So that is the visual hallucination. They are seeing, actually they are seeing the ghost inside the house. Somebody says that there are black cats in the corner of the room. Actually, there were nothing. So he is seeing the black cats inside the room, or he is seeing some animals, or he is seeing someone who is not at all present there. That is the visual hallucinations. Next common hallucinations seen in psychiatric patients is tactile hallucinations. Tactile means touch. So the five senses have disorders of perception, that is hallucinations. So tactile hallucinations. The patient says that some insects were crawling over my body. Some worms are crawling over my upper leg or my arm. That means it is not there. The insects are not there. The worms are not there. But they feel it. They just feel it. So they tell that, yes, you look at this thing. You look at this arm. Yes, insects are crawling. I can see it. I can feel it. I can take it. Yes, this thing. But there is nothing. That is tactile hallucinations. Another common is auditory hallucinations. Auditory means hearing. So through hearing, the patient hears the voices from outside which are not at all present. The patient says that again it usually occurs in schizophrenia or psychotic depression. Also in psychotic states. Whatever psychotic illnesses are there, the patient can have these symptoms. The patient says that I hear voices from outside. So the psychiatrist asks, what are the voices? Some voices are telling, that is, some voices are telling lies about me. Some two voices are speaking there. I can hear it. These voices are referring me. The voices are speaking about me. Or I can hear voices telling me to do this thing, telling me not to do this thing, which I do not want to do. They are forcing me to do. That means auditory hallucinations. So they are forcing me. The voice is forcing me to do this. The voice is forcing me to say this. That is, the voices are not at all present. There is no any person there. If any person is there, they are not at all speaking. But they are telling that I am hearing voices from outside. It is coming from outside into these ears. So I am just obedient to them. This is the auditory hallucinations. So these are the disorders of perception. That is, one is the illusion, that is misinterpretation of external stimuli. For example, a rope is considered or the rope is perceived as by the person as a snake. Second is delusion, that is false, unshakable beliefs which are continuous, which are persistent. Example, delusions of persecution, that is someone is following me, someone has put poison in the food, someone is going to kill me. Delusions of reference, that someone is telling something about me. And grandiose delusions, that means I am a supernatural human being, I am the President of India, I am the Prime Minister of India, I am the President of America. Like grandiose delusions are immensely rich. Delusions of infidelity, which is seen in alcoholic persons who are having an alcohol dependence due to alcohol abuse, that the wife is not faithful and she is having extramarital relationships. Hallucination, that is, he is hearing or seeing something which are not actually present. That is visual hallucination, seeing ghosts, seeing animals, seeing something which are not at all present. Tactile hallucinations of touch. Some worms or insects are crawling over the body. Gustatory hallucinations, that means the hallucination that is in the tongue. Gustation means this taste. So the salty food is given, the patient says that it is sour. The sweet food is given, the patient says that I feel it is sweet. Like that, the hallucinations of the tongue, hallucinations related to the taste. Auditory hallucinations, that is the voices. He is hearing voices which are not at all present. He is hearing voices telling him or her to do that, telling him not to do that, or some voices telling lies about him, some voices telling reference about him. Auditory hallucinations which are not at all present. So these are the words which are coming under the disorders of perception. I think you are clear now, and more words, both psychiatric words and more psychiatric illnesses, common psychiatric illnesses and commonly used psychiatric words we can discuss in the upcoming videos.